Hello and welcome everybody to this discussion of the abdominal examination part of gastrointestinal examination. We're going to try to make these a series of short videos to make it easier for you guys to focus, to make it easier for you to listen when you have time and return to them later when you need to, and not have to navigate through a big long video file. So hopefully this really helps you a lot. Whenever we begin, I always like to remind you guys that we do these skills well. We seek to learn them the best way we can because we really want to take care of people. People are made by God. They are precious. As a result, they're valuable, and we want to take really good care of them ourselves as their doctors. And so that's true whether you're a Christian like me, whether you're a Muslim like the majority of you. We want to take really good care of human beings. So let's talk about how you do that through abdominal examination. I'll remind you that the gastrointestinal system starts at the lips and goes all the way down to the anus. And so it's traversing most of your body and nearly through every body cavity. So we're going to focus on the abdominal examination part, but know that the rectal examination that is in another video and hernia examination are all a vital part of a complete gastrointestinal examination. So this is just one piece. We're going to break it into 3 shorter videos, and hopefully it helps you guys to study as you look through this material. So just gives you an overall view of what we're going to do. You're going to want to look at the positioning of the patient and the environment. We'll address that briefly in a minute. We're going to talk about inspection, both the general inspection, the specific inspection. That's actually the focus of this video. We're going to talk about auscultation. Notice how I'm putting auscultation ahead of palpation and percussion in this particular topic because once you stir up the abdomen by palpation and percussion, it actually can activate the bowel sounds. They can be more prominent than they would be otherwise. And so I was always taught that you go ahead and do auscultation before you do those other things on the patient. And that's what my physical exam textbook taught in medical school and my teachers taught. I know that McLeod's is a little bit different. So do it however you like, but know that there is some difference of opinion on that. Then we'll get into palpation and percussion, of course, and then we'll talk about other tests that we do that are unique to the abdomen and that we need to give some time to considering. Okay, so this video is going to be about inspection, and I want to cover general inspection because it's very, very important in every examination that we do, but just a special reminder as we look at the abdominal examination. And then I want to talk about specific inspection of the abdomen itself. So we'll do those 2 things in this video, and then we'll end, and then we'll move on to other topics in the videos to follow. So as we get into inspection, obviously before we begin looking at the patient, we're going to worry about the environment, make sure that it's set up appropriately. So we're going to make sure there's good lighting. We talk about issues like jaundice or pallor. It's really important to have good lighting to enable you to see those well. Most of the time when I've seen jaundice in a patient, my first thought was, wow, that patient looks really strange. The lighting must be wrong in this room. And in fact, of course, in those cases, it's the patient that's yellow and the lighting is just fine. But in a poorly lit room, it can be difficult to detect things like jaundice. So pay attention to that. Want to make sure the environment is warm. We're going to be exposing the abdomen. And, when it's cold, people tend to tense up their muscles. And it's really important that the abdominal muscles be relaxed when we examine the abdomen. So warm up the environment. Maybe tuck your stethoscope into your white coat to get it nice and warm to your body temperature. Make sure your hands are nice and warmed. Make sure you keep them in your pockets. Make sure you are warming them up as you get ready to lay hands on the patient, because that will make up the abdomen. That will make the abdomen tense up quite quickly if you put cold hands onto the patient. Okay. It's going to be important to have their abdominal muscles relaxed. As we said, that's not just a factor of temperature and our hands and our stethoscope in the room. It's also part of positioning, right? So you're going to lay them supine, laying down on the examination table, and you're going to put a pillow under their head. And raising the head up like that does tend to relax the abdominal muscles. There are other maneuvers you can do to relax the abdomen if you need to, such as having the patient flex at the knees and move their feet closer to their body as they're laying down. You can also have them put their hands together like this and pull, and while they're focusing on pulling at the hands, they tend to relax the abdomen as they're laying down to help you examine. Those things can be really important in kids or less cooperative patients. Okay. All right. So when it comes to general inspection, I talked about how important this is. You want to remember CS1 in that first semester when we talked about general examination. What are the things you're going to look for? So you're clearly going to look at their general appearance, how they're dressed. Maybe they normally wear a belt, but they aren't wearing a belt today because their abdomen is distended and therefore the belt doesn't fit around them anymore. Little things you might notice like that. Obviously, there are a wide range of things you can notice on appearance, including their level of consciousness. So if they're sleepy, you want to make note of that. You can certainly have liver disease that makes you very sleepy, not alert, and difficult to get a history in those patients. You want to look at their demeanor. Are they in pain? Are they anxious? You want to look at their color. We already mentioned jaundice, that bright yellow color. We also talked about pallor. If somebody has a gastrointestinal bleed, they might be very pale. Okay, and of course, for both of those things, you can look at the conjunctiva and the sclera to give you a better look at jaundice, apart from skin tone differences from patient to patient. Or the palms is another place you can look for that, maybe comparing your own palm to their palm. I'll try to show it to you guys instead of myself. Their smell. So you might smell the smell of blood if they're having blood in their stools. You might smell what they call fetor hepaticus if they have liver disease, which is a specific smell that is difficult to describe, but that you'll know once you smell it, once you have experience with some of these patients. Because of a chemical in their breath, you smell a particular odor when they breathe out. You're going to want to make note of their nutritional status. The gastrointestinal system is obviously super important for absorbing the nutrients you need to live. And so somebody who looks very cachectic and malnourished, that is a really important factor to consider in your examination of the gastrointestinal system. You may notice that they're super obese, overnourished in that sense. And so you want to make note of that as well. Lastly, we talked about, not lastly, but the last few things, the mouth and the tongue. You might see findings in there like ulcerations that might go along with inflammatory bowel disease, such as Crohn's disease. You want to examine those. You might notice angular chylitis, where there's cracking at the corners of the mouth because they have iron deficiency, and maybe that's because of gastrointestinal bleeding. That kind of thing. Other nutritional deficiencies will manifest with the mucous membranes, particularly in the lips. So you want to pay really close attention to that. The hair, the hands, the nails. You really want to pay attention to various findings there, whether it's leukonychia for somebody with liver disease and low albumin in their blood, whether it's hair loss because of hormonal changes due to liver disease, that kind of thing. So just make note of the hands and also the other integument, the skin, the hair, the nails, as you go through the general inspection. And then lastly, lymph nodes. Somebody with malignancy of any type might have swollen lymph nodes throughout the body. Particularly, we worry about these supraclavicular lymph nodes, especially on the left side of the patient, as a sign of abdominal malignancy. And so you do want to pay attention to the lymph node examination when you generally inspect and examine the patient. Okay, so remember CS1. You guys can go back and watch those lectures on Moodle if you want to. I don't want to spend the whole lecture talking about them, but they are really important for every examination, every body system, and these are some specific ways where they're important with the gastrointestinal examination. Okay.
And calculate the BMI. Look for nail abnormalities such as leukonychia or quilonychia.
Turn them over for me.
Palmar erythema is a sign of chronic liver disease, although it can be normal in pregnancy. Look at the nail specifically for finger clubbing. This is occasionally due to gastrointestinal disorders such as liver cirrhosis, inflammatory bowel disease, or malabsorption.
Could you place your arms up in front of you and cock your wrists back, please?
Asterixis is a coarse, flapping tremor seen in liver failure. It can also be seen in cardiac, respiratory, and renal failure. Look for needle tracks, tattoos, and a paucity of axillary hair. More than 5 spider nevi in the distribution of the superior vena cava is a sign of chronic liver disease, although again, this can be normal in pregnancy. Remember that this includes the upper back, and you also need more exposure than is demonstrated here. Palpate for cervical lymph node enlargement, which may be present in lymphoma or metastatic disease. Bilateral parotid swelling can be a feature of chronic alcohol abuse.
Bring your legs back up. Just rest your head back.
Look for spider nevi in the face and pallor and jaundice in the eyes.
I'm going to look in your eye. Look up for me.
Under natural light,
And down.
jaundice is a diffuse yellow discoloration of the sclera.
Now can you open your mouth?
Look for angular stomatitis and aphthous ulcers. Also inspect the dentition. You may smell a characteristic fetor.
And stick your tongue out. And
The
back
tongue
in.
can be affected by iron, B12, or folate deficiencies.
I'm just going.
Okay, so that was just a brief video walking you through the general inspection of a patient on whom you're doing a gastrointestinal examination. So just a reminder of some of the things he mentioned. This is a good slide to study on your own at home. It's also in McLeod's, this picture. Just reminding you of the diverse things you can see on general examination. And in this case, these are the findings specific to liver disease. I would point you to caput medusa around the umbilicus, the picture of the spider nevis, which, when you touch those in the center, they will blanch, they will turn white, and then they will refill from the center outward when you remove your finger. Any of those you find in males are abnormal, and again, up to 5 in a female. You can count as normal, and again, they may occur in pregnancy. Other findings, obviously, we mentioned jaundice, you can see at the eyes, gynecomastia in men, or breast atrophy in women. Then there's a picture of leukonychia, which we mentioned already, again, due to hypoalbuminemia. Palmar erythema, there's a picture down there of that, which again, can happen in pregnancy. It has to do with the hormonal processing of the liver and the fact that it can't do that job very well. And then occasionally clubbing. You'll see testicular atrophy in the genitals, hair loss and edema in the legs. You'll see, because again, that hypoalbuminemia leads a low oncotic pressure, which causes the soft tissues to fill up with fluid, and easy bruising and hair loss, and all of these things you could see, including splenomegaly, in addition to the hepatomegaly, although the liver may be small and scarred and cirrhosis. Again, all of these things you can see. So just a reminder of what kinds of things you're looking for when you do the general inspection. Again, this is specific to liver disease, but every disease has their things that you can see when it relates to the GI system. So here we have a picture of asterixis. He showed you how to check for it on the general inspection. But of course, that was a normal patient, so she had no asterixis. So I wanted to include that in this particular lecture, just that flapping motion that the patient shows when you bring their hands back. All right, let's talk about specific inspection. So we moved from general inspection to looking at the abdomen itself. So we're going to expose the abdomen from the xyphosternum, so just under the rib cage, down to the symphysis pubis, so down to the pelvic brim. And what are we looking for? We're looking for the contour or the shape. Is it protuberant and distended? Is it scaphoid and kind of caved in like normal? Is it thin? Is it obese? This is what you want to look for. You want to look for movement. Is the abdomen moving normally, or is the patient kind of splinting? They're trying to keep their abdomen still due to an intra-abdominal process that might be causing them pain. You want to inspect the skin for striae, like you might see in Cushing disease, or bruising, like you might see again in somebody with an elevated INR, if you guys know what that is, or just poor blood clotting, thin blood in liver disease, say. You might see bruising, or in pancreatitis, you might have a hemorrhagic process in the abdomen that led to bruising. We'll talk about that in a second. Visible veins, so things like the caput medusa from portal high blood pressure that we mentioned earlier. And then, of course, scars from surgery, any stomas they might have because of prior abdominal surgery or colon surgery. Want to make note of all these things as we look. So yeah, just an example here of what you'd look for on inspection. You can see that this patient has those distended blood vessels, the visible veins. You can see the bruising on the abdomen there to the left side of the picture. You can see the bulging out at the umbilicus. Obesity usually makes your umbilicus cave inward, whereas ascites, or increased intra-abdominal pressure, will cause it to come outward. And again, that's abnormal. So these are all things you might see on, in this case, a patient with liver disease and ascites. But again, just gives you an idea of the types of things you would be looking for. This is, again, the visible veins and caput medusae with some other findings, like a protuberant abdomen, distended with ascites fluid, with the umbilicus poked outward and with the bruising visible. Okay. So again, I mentioned scars. These are various scars you could see in a patient you're examining, and you don't need to know all of these, but just as a reminder, you'll see different scars that indicate different problems people have had in the past. And this is again a picture from McLeod's that we're not going to quiz you on the names of scars or what they indicate, but just something to be aware of. What are you looking for when you do the inspection of the abdomen? Okay. Another thing you might see is Cullen's sign. Again, notice that umbilicus poked outward. Cullen's sign is typically found in a hemorrhagic pancreatitis or a hemorrhagic intra-abdominal process. And you just see blood under the skin near the umbilicus. That's what Cullen's sign is. And there you have Dr. Cullen on the left. And then we also have Dr. Gray Turner and the Gray Turner's sign named for him. This is the hemorrhage you see in the flank of the patient, so along the side of the abdomen, that indicates any kind of retroperitoneal bleeding or retroperitoneal hemorrhage. So there's behind the peritoneum. So things like, again, the pancreas, if it is to hemorrhage, it's a retroperitoneal structure. Therefore, you'll see the blood in the flanks there with Gray Turner's sign. And again, there is Dr. Gray Turner. So, thank you guys for paying attention to this brief video about general inspection and inspection. So, process it, look at it, study it, internalize it, and the next part 2 will cover palpation and percussion. Thank you very much for your attention, and I will see you in the next video.